Welcome back everyone. Today I'm going to show you some lower back exercises and stretches to give you some pain relief in the lower back if you spend a lot of time working at a desk or at a workspace for long periods of time. Now, obviously the easiest solution would probably be spend less time working at a desk or get up and move around as frequently as possible, but that could be quite unrealistic due to the time constraints that you have to work at your workstations, especially if you're allocated to work at home due to COVID-19 and self-isolation. These stretches and exercises not only will prevent pain, but also prevent possible degenerative change or postural injury in the future, and obviously prevent any pain that could be radiating down the lower back from sciatica or sciatic symptoms. I hope these stretches help you as much as they help me and my patients.
Lumbar extensions. Lay down on the ground and place your hands next to your body and push yourself up with both arms extended, whilst keeping your hips nice and close to the floor as much as possible. This will promote lumbar back extension and will slightly stretch the abdominals in the front. Whilst you're doing this, please try to keep yourself in good posture and avoid having your shoulders rounded forward and your neck protruding forward or looking down. If you do this, it will promote poor posture and even give you neck strain or tight shoulders. Instead, pull your shoulders back, keeping your head up and looking slightly above the horizon. This is a technique commonly known as Mckenzies technique, and it's been used for decades in yoga as a cobra pose for lower back pain. Hold this position for about 30 seconds to a minute and repeat the exercise 3 to 4 times. Some rehab specialists out there would even prescribe this exercise to do for 5 to 10 minutes at a time. But in this video, all I want you to do is hold this position for about 30 seconds to a minute and repeat the exercise 3 to 4 times. If you feel like there's too much pressure in the lower back, or there's a bit of pain there from the cobra pose, or you don't have enough strength in your arms to push yourself up, I recommend trying a less intense position with your elbows flat against the floor, also known as a Sphinx pose. This will reduce the amount of extension in the lumbar spine and therefore reduce the pressure or the pain that you will get from this exercise. Everyone is in different stages with their rehab, so I recommend if you are in pain, just try this exercise first before doing the cobra pose. I know this video is intended for lower back pain in sitting positions, but if you do have a disc bulge or a disc injury or lower back pain or extreme lower back pain, I recommend checking out the other videos on this channel for lower back pain first before trying any of these exercises. Hold this position for about 30 seconds to a minute and then repeat the exercise 3 to 4 times. When you're in a seated position, your hips posteriorly rotates backwards and your lumbar spine is in a flexed position. So stretching the lower back into the opposite direction, which is extension, can give a lot of relief for many people. A research paper was released in December 2012, comparing the effectiveness of manual therapy versus the Mckenzies method for chronic lower back pain patients. The results showed that after 12 months, there was no difference between which one was more effective. However, patients that followed Mckenzies method had a better result with their disability measures, meaning they were able to have better functionality with daily tasks. So I highly recommend doing the cobra pose, also known as the Mckenzies technique. Hip drop stretch. Grab the knee on the opposite side and pull it over to the same side with your hand. And in a relaxed manner, allow your other arm to be outstretched towards the other direction. This will act as a counterbalance to promote the upper back to be against the ground. This stretch will work on the lower back muscle on an angle and the posterior hip muscles such as the glutes. You may hear some pops and cracks in the lower back as it loosens up and your joints start moving. However, please do not force these pops and cracks, as you may hurt yourself or even create hypermobility in your lower back, or even cause spasming in your lower back muscles. Hold this stretch for about 10 deep long breaths or 30 seconds on each side, 4 to 5 times. If you would like to increase more intensity in this stretch, just extend your leg out to create more torque on the body. And by breathing in a relaxed manner, your body will relax more and create a better stretch as well. This is one of my favorite stretches to do, especially after a long run or heavy lifting. I noticed that my patients gained a lot of pain relief and were able to resume their daily activities with doing this stretch on a daily basis. A few of them even started teaching their friends and family this stretch. Just on a side note, I would like to mention a few things about the mechanics of the lower back. Besides extension and flexion, rotation is a very effective way to reduce lower back tension and pain. So if you don't have enough time to do proper stretching, just twisting your lower back a few times in each direction and holding the stretch for a couple of seconds can significantly help with your lower back pain. Hip flexor stretch. Go into a kneeling position and try to have all your knees and joints starting out in a squared and bent position. Then push or thrust slowly, imagining that you're pushing an arrow through your hips to the front with your glutes squeezed. Please try to position your hips properly before performing this stretch and rotate the hips back in posterior tilt position, a bit like tucking your tailbone in. This will promote posterior hip tilt and help combat the opposing position, which is anterior hip tilt. If you've never done this exercise before, try to do it next to a wall or a coffee table or your couch so you have a bit of stability just in case you wobble and fall over. I also like to have something under my knee to support it, like a folded towel, so my knee doesn't get hurt against a hard floor. But since I'm doing this on a soft mat, we're just going to go without one. Hold this stretch for about 30 seconds on each side and do this 4 to 5 times. Whilst you're holding any of these stretches, make sure you take long and deep breaths every time you hold a stretch, as this will teach your muscles to relax with breathing. It's important to stretch this muscle because the hip flexor muscle is also known as the psoas, and it's connected from the hip bone into the lumbar spine, which is your lower back. And additionally, the hip is held in a flexed position while sitting, so moving in the other direction would likely help with lower back pain and hip pain. If you want to accentuate the stretch a little bit more, just squeeze your abs and glutes to increase the intensity of the stretch. Hamstring stretch and nerve flossing. Find yourself a strap or a long belt and place it at the upper end of your foot, either on the ball of the foot or just above the midfoot, and lay on the ground and bring the leg towards your chest. Once you are ready, extend your leg as straight as you can and raise it up as high as you can. This will already create a stretch in the hamstrings. Now, to create a nerve flossing effect in the sciatic nerve, just point your toes back and forth whilst maintaining tension in the belt that you're pulling the straight leg towards yourself. Do about 20 repetitions on both sides, nice and slow, and repeat it 3 to 4 sets. Stretching the hip muscles can significantly influence the lumbar spine and the relationship it has with the hips. By coupling the hamstring stretch with nerve flossing, it will help reduce pain and improve functionality of the lumbar spine, the lower back, if there's any impingement in the sciatic nerve or any other nerves that branches out from the lumbar spine. The sciatic nerve originates from the lower back, and mobilizing it gently can aid in keeping things mobile and pain-free.
Once again guys, thanks for watching. Now I really want you to join my VIP Facebook group. I want to build a community there where you can ask questions and I'll try my best to answer them as much as possible. There'll be other professionals in that group, so they can help you out as well. I'll put a link in the description box below. Now, if you found this video helpful, there could be a chance that you could have sciatica or sciatic symptoms that could be coming from the lower back or the hip. So check out my 11 best sciatica stretches video. That video will definitely help you out if you do have sciatic symptoms. Now, if you found the hip stretch in this video helpful, there could be a chance that you need to mobilize your hip joint. So check out my hip joint mobilization video. That video will definitely help you out if you do have hip impingement or hip immobility that could be causing compensation that is causing you pain in the hip if you spend a lot of time sitting or doing a lot of hip flexion movements. Remember, support my channel, hit subscribe, hit like, give me a thumbs up, and comment below if you have any questions, and I'll see you guys in the next one.